I got started in this line of work of medical interpretation when I started volunteering at a hospital back home in Arizona. I was in the PACU as a volunteer cleaning, and very frequently people would ask if I could help with limited English proficient patients. And one thing led to the next. I became a volunteer interpreter for a year, and that's how I gained my experience. Off the bat, one of the most challenging things is probably not the most obvious. It's actually interpreting jokes. People's humor is very difficult to interpret. Things like very colloquial speech and jokes can actually become very difficult. But aside from that, and on a more serious note, it's difficult, I think, for a lot of professions here in the medical field to give bad news. You need to kind of center yourself, be present in that interpretation, and try to maintain a neutral position. And so, although you want to be very human and compassionate, it's very important that you communicate the message. What I find most rewarding about being an interpreter is being there for someone in a very vulnerable moment, a very private and intimate moment, and to be a voice and to be a person that can very accurately communicate their concerns. I think that's something that transcends all types of barriers. I personally have been inspired to be a doctor or possibly a physician assistant, and so that's something that I can say I have very dear to my heart, and I've learned so much from just being in the encounters and being a part of that exchange, and you learn how to treat people right.
¿Estaba sacando algo con la tos?
No, nada más era una tos, una tos.
No, it was just cough and cough.
And at that time you were hearing that high-pitched noise.
Y en ese momento estaba escuchando ese sonido de alta frecuencia, ¿no?
Sí.